OralAdvance is a simple test for early detection of oral cancer. It has been developed by Perceptronics Medical Inc. in collaboration with the BC Cancer Agency. We have worldwide exclusive license for their technology, and we offer this test from our laboratory. Laboratory is an accredited laboratory, and it is set up to receive specimens from across Canada as well as internationally. It should be used in a dentist's office during the regular oral cavity exam. It's something that every dentist can do very easily during the regular checkup, and it doesn't require any extra special equipment or setting. OralAdvance adds maybe a minute to the entire procedure, so it really does not require much to search for such a deadly cancer. Oral cancer belongs to the group of the orphan cancers. It is being reported that the number of people dying from oral cancer is going to be higher than the people that are dying for cervical cancer. And the main reason for that is because there is no systematic approach for oral cancer detection. The situation is changing because more and more dentists are now looking for oral cancer during the annual exams of a patient. OralAdvance can help a lot in assessing the malignant potential of the lesions that are seen during these exams. This technology originates from the BC Cancer Agency, and Perceptronics holds the worldwide exclusive license for this technology. The underlying basics of this technology is the measurement of DNA in the nucleus of the cell. And what we are able to measure is actually a fine chromatin changes in every nucleus. It sounds very sophisticated, but if you look what it really is, it's a fancy microscope, fancy camera, and proprietary software. So what happens in our laboratory when the specimens are received, lab technologists and technicians, they prepare the slides from that specimen. They are stained with a proprietary stain, and then the microscopes are simply scanning those slides, identifying nuclei that are of abnormal content of DNA. We have a highly specialized cytotechnicians, and we have expert pathologists on our staff who, after the scanning is done, then there is addition to that. It's a step where there is a human intervention. It will be highly unlikely that the computer can do everything really without interference with experts. So our report really comes as a combination of what the computer will say and what pathologists and cytotechnologists will see on the slide. Again, it comes with either DNA abnormality is present or the DNA abnormality is not present. However, the report has to be always interpreted in the light of the whole picture, which means really at the best judgment of the dentist. The test is very simple, and as I said, it's painless. Since we are using a soft brush which is developed for oral mucosa sampling, really the sensation that you feel while dentist is turning the tip is like a toothbrush, not harder than that. Dentists are really, they know what are the predisposition sites, if you want, in the mouth for the oral cancer. Because oral cancer, even though it can theoretically show up everything, there are certain areas in the mouth where they show up more frequently. So usually dentists will pull the tongue on one or the other side, and then when they see something either by the naked eye or, as I said earlier, by the using of some of the visualization technologies, they will notice a spot or a lesion, and then they will simply use this brush, turn around 10 times over that lesion in one direction only, collects the specimen, there's no bleeding, and then it has been analyzed here. The brush has been designed for the oral cytological sampling. It's actually designed by the group in the Netherlands, and it has been CE marked, FDA approved, everything for that particular purpose. The brush has a removable tip, and then tip is removed in the vial, you know, the stick you throw away, obviously, and then that tip with the vial is sent to our laboratories. The reports are usually coming in 2 to 3 working days from the moment we receive our specimens. Our laboratory really is looking to fast turnaround times. We are accredited by a diagnostic accreditation program in the BC, and we are very proud of what we have achieved so far. Particularly, OralAdvance is a good complementary test that can be used in conjunction with the fluorescence technology. By no means we are saying that this test should replace biopsies. Biopsy of the oral cavity always is a gold standard when you want to establish the final diagnosis. However, OralAdvance really helps in that intermediate group when the dentists don't know really, should I biopsy this or should I not? It doesn't really look like a real cancer, but maybe it is. So if one needs the assessment of malignant potential of the lesion, OralAdvance is the right test to do.